Hi, I'm Edward and welcome to HR Hot Topics, where each week we dive into the latest HR and employment law stories. Don't forget to subscribe and click the bell if you want to see more of our videos. And use the hashtag askhrhubplus to get in touch with us on social media. As the number of monkeypox cases in the UK rises, employers have been advised to conduct risk assessments and ensure they follow standard sickness procedures if a worker becomes infected. There have been 1,351 confirmed monkeypox cases in the UK as of the 4th of July, but the UK Health Security Organisation has said the risk of the virus spreading around the general population is low. Many countries in Europe and North America are seeing increasing numbers of the people with this disease, which is usually only found in Central and Western Africa. Although self-isolation is only advised and not currently a legal requirement for close contacts, employers have been urged to allow affected individuals to work from home where possible. Anyone who contracts the virus and is unable to work should be paid in line with usual sick pay policies, employment law experts have said. The UK has not yet offered any specific monkeypox advice for employers. Now, this is important because it relates to sick pay for staff with monkeypox and their contacts. Now, it goes without saying that if any employee has a confirmed case of monkeypox, they should be treated under normal sickness rules. Most symptoms clear up within 14 to 21 days, so they would receive statutory sick pay or full sick pay, whichever is stipulated in their contract of employment, as with any other illness if they meet the qualifying criteria. Now, if the person cannot work from home, then the question of pay crops up. SSP, statutory sick pay, will not be payable for the isolation period unless the employee gets too ill to work during it. In a similar way to the current COVID isolation position, employers will have to decide whether they will require close contacts with a confirmed case to not come to work for the 21 days or whether they will still require them to come in. The potential cost of paying staff to self-isolate will be low due to the relatively small number of people infected with monkeypox. But employers should consider the future impact of any policy decisions made now should cases grow. Beware of discrimination. Now, a notable proportion of cases have been identified amongst the LGBTQ+ population, particularly men who have sex with men. People in this group have been advised to be aware of the symptoms, particularly if they have recently had a new sexual partner. Symptoms of monkeypox include fever, headache, muscle aches and exhaustion, followed by a rash, most commonly found on the hands, arms, feet, or legs. Employers should be careful not to make assumptions about LGBTQ+ staff or African employees. Employers should also consider how they might minimize the risk of monkeypox spreading at work. Adjustments may be required to minimize the risk to pregnant or immunosuppressed people. Now, those who have unprotected exposure to infectious materials should be excluded from work for 21 days if their work involves contact with immunosuppressed people, pregnant women, or children. Again, working from home could be a solution here, or moving the employee to different duties which does not involve contact with those people. Now, this is a warning note. Despite the virus presenting a low risk to the general population, I would advise employers to be prepared should the situation change quickly. An important point to make is that monkeypox is not another COVID. Now, this is very, very important. We might be drawn to think this because of the use of the word or phrase isolation, but experts say it poses a very low threat to the wider public. It is not as easily transmissible as COVID, and recovery is fully expected. However, as we saw during the pandemic, things can change pretty quickly. Thanks for watching this installment of HR Hot Topics. Let us know in the comments down below about what your company is doing in response to monkeypox spreading. Use the hashtag askhrhubplus to get in touch with us on social media. Don't forget to like and subscribe to keep up with other videos on our channel. And we'll see you next time.